If you're tired of having tight hips, or if you're struggling to improve your patient's hip mobility, then this is for you. What I want to do is share my 3-step system as to why I actually avoid stretching to improve long-term hip mobility. Step number 1, comprehending the difference between positional versus physiological tightness. Now, this is a great analogy that I like to use with patients so that they can better understand how I like to differentiate what I call true tightness versus fake tightness. So let's start with physiological tightness. This is what I refer to as the true tightness, and it's really just what it sounds like. There are structural changes that have occurred at the tissue level that have genuinely made it tight. And usually this is from surgical intervention where there's scar tissue, right? And so we have a change at the joint or the muscle that has now impacted movement. So this is on the true side. The thing is, most of us are on the false side, which is the positional tightness. Positional tightness is when the muscle shows that it's tight, but it's not actually tight. It's in a position that's causing it to be tight. For example, let me back up so you can see my legs. And an easy way we can demonstrate this is if I turn to the right side and if I stay oriented to this right side. If I now raise up this right leg, you can see my foot. If I stay to the right and raise up my left, you cannot see my left foot. So the left side would be labeled as tight and the right side would be loose or normal. Well, if we now orient to the left side and I raise the right side up as I stay in this left hip, the right side, you can now not see that foot. If I stay to the left and I come up, you now start to see the foot. So what happened? Now this is normal and this is tight. Well, they're not tight or normal, they're just in a position that's causing them to be tight. And when it comes to stiffness at the hips, a lot of us are in a position that's causing the hips to be tight. So when we go to just stretch without changing the position, we just run into short-term effects of feeling good walking out of the door, but then the tight hips come back, right? How many of us have to constantly stretch our tight hips? Well, if we did something that was more on the long-term effect, that fixed the true problem, then we wouldn't have to stretch them every day. And so this positional problem that usually happens is when we have a rib cage that is flared, we're in extension, and the pelvis is in an anterior pelvic tilt, right? How many of you have patients that are in this pattern? Probably a lot. Well, what happens is the hip flexors and the psoas run from the lumbar spine across to that hip. When we're in that extended position, it causes them to be in that concentric, kind of ready to go position. So if we now are in a pattern of extension, right, and we just want to do a stretch and we grab our leg and we do the traditional hip stretches as we stay in our current pattern, the position is just going to continue to cause that to be tight. So what we need to do are really two things. We need to learn how to breathe. Why? Because the psoas is on that lumbar spine, highly integrated with the diaphragm. In addition, when we're in this flared, extended position, breathing becomes very challenging. So when we start to get the rib cage to go down and the pelvis to go in a posterior direction, then we start to essentially inhibit that psoas and the hip flexors that have been on all day. So we really need to improve our breathing strategies, and then after that, we then need to strengthen a new pattern. So the big takeaway is that the hips remain tight because we never truly change the pattern. Change the pattern and you'll change your patient's mobility. Step number 2 is to improve respiration strategies. So remember, we are trying to change an overall pattern. And the pattern that we just previously discussed is that the rib cage is flared up and that the pelvis is in an anterior pelvic tilt, right? And what this does is this forces the hips to be tight based off the position. So instead of wasting time stretching and continuing to stay in this overall pattern, we can skip the stretching and just change the pattern. When you change the pattern, the muscles have to respond, and that's what gives the length to these tight hip muscles. So Breathing is really our staple point, just like a foundation of a house. If you have a second floor problem and you continually fix that second floor problem, but it doesn't go away, what tends to happen is that you then need to recognize that maybe it's not a second floor problem. Maybe there's a foundation that's cracked or leaning or faulty that needs to be fixed. And in that case, you would need to remove the second floor, remove the first floor, and fix the faulty foundation. Once you have a strong foundation, then you build back up. That is exactly where we're at step 2. We are building a stronger foundation by getting the ribs and the pelvis synced up with breathing in a better position. So that's exactly why we're starting here, to improve our hip mobility, right? So what's going to happen is the goal of the breathing is to first off get this pelvis in a more stacked position underneath the rib cage. So we do that by moving it in more of that posterior orientation. We then need to work on bringing the rib cage down. Well, you can't really do that. You can bear down, but that's not going to improve anything. But you can do it when you start to breathe. So the goal of the breathing is to hold this pelvis in a posterior oriented position, get the rib cage to come down through breathing, and then repeat, right? So what we're going to do is we're going to add a dumbbell. You can use a yoga block. It doesn't need to be a dumbbell. It's not about the weight of the dumbbell. It's about getting our arms in a shoulder width position and driving them in to provide a little bit of external rotation through the shoulder. So all we're going to do is a 90-90 position. So the shoulders in about 90 degrees of shoulder flexion. We have the elbows in 90 degrees of elbow flexion. From here, all we're going to do is cue our patient to inhale through their nose. As they exhale, we're going to reach. When they reach through the elbows. And what that's doing is protracting to aid in the rib depression, right? So we are reaching on the exhale. The patient needs to feel their rib cage drop, and then this is where the magic happens. They need to be able to inhale without their ribs coming back up. Hold onto the ribs as they inhale, and then as they exhale again, they're going to reach and continuously exhale until they feel their ribs drop down. Repeat this for 4 times, really making sure that the patient is confident and has the awareness that the ribs are dropping and that they're not bringing them back up on the inhalation. Step number 3 is strengthening the new pattern. So now that we have a better idea as to how to optimize breathing so that we can improve hip mobility, we then want to strengthen it. Again, the principle is the key component here. When we're in this anterior pelvic tilt that we're trying to fight, there is compression anteriorly and expansion posteriorly. The compression anteriorly means that that's what's creating that stiffness in the first place. So when we start to create compression posteriorly and expansion anteriorly, that's how we start to change the pattern and improve the hip mobility without stretching. So that's what you want to think about when choosing exercises, is what muscles are going to compress back here, right? And essentially, in this exercise, we're just going to start to target the hamstrings to posteriorly orient the pelvis and then get stronger at it. So when it comes to choosing the exercise, you always need to understand the intent and understand the position, right? So in this position, we're in a 90-90 position, 90 degrees of knee flexion, 90 degrees of hip flexion. What this does is automatically moves that person towards that posterior orientation that we're looking for, right? So it's a win right off the bat. With this exercise, we have a ball between the knees just to keep the knees in a neutral position. We are going to go into that posterior pelvic tilt, kind of stacked position. We're going to feel the wall and get grounded through the wall, because once we're grounded through that wall, we have a better ability to move the pelvis, right? It becomes a closed chain exercise, so we can really leverage our pelvic motion, right, compared to the femur. So We're going to feel the wall. We're going to dig the heels down to engage. You should be able to see the hamstrings engaging. We're going to maintain that posterior tilt. We're going to reach those knees up so we stay in more of a swooped position. As they go up, we want to make sure that we don't arch through our back, right? So bring the heels down, engage the hamstrings, tuck the tailbone, maintain that tuck, reach the knees as you continue to drive down. And a good cue I like to use is that telling the patient that if the bench wasn't here, their heel would hit their butt. They're trying to bring their heel towards their butt. We're holding on to these hamstrings in this swooped position. You see, I actually just had to correct that. I was falling into extension. And all we're going to do from here is hold this. We can then add breathing in if we want, or reach, right? And so now we're getting the ribs to come down. We're using a muscle that helps to change the position of the pelvis that is causing the problem. Once we start to really build strength in this new position, that's when we're going to continue to see improvements in our deficit in hip mobility.